Now, yesterday saw Gauteng Health MEC Dr. Bandile Masuku tabled the department's budget vote for the 2020-2021 financial year. Masuku said that the department saved more than 38 million rand through mediation in liability suits between October 2019 and March 2020. He joins me now to discuss that budget further. MEC, good morning to you. Thank you so much for your time. So you have 57.7 billion rand budget for this financial year. How much of that will you be spending to combat COVID-19 in the province?
No, we will be spending money, reprioritizing, and it will all be within our programs that we have been having. Because what we have done is that we have repurposed and readjusted our budget within the priorities that we are having. So there's nothing much that we will be changing. We'll be continuing to implement our program, our strategic plan, within which most of the parts will be for actually COVID-19.
Yeah, this budget speech, MEC, took place at a time when the health system is stretched and is expected to be stretched further because of COVID-19. How much of that will you invest in infrastructure? I'm sure you'll agree some hospitals are in deplorable conditions and we need more health facilities.
Yes, we are going to spend almost 1.4 billion on building extra capacity in terms of wards in 4 facilities at Bara, Kopanong Hospital, Jubilee Hospital, and even actually George Mukare. And this is the capacity that we are going to see as a legacy actually project that will remain for us to continue to offer the services beyond the pandemic.
Any timelines for the new facilities that will be built?
The facilities would be ready at the beginning of August because we are using alternative building technology, which usually is quicker and faster. And we are, have started with the projects in all these, areas that I've mentioned.
All right. MEC, concerns have also been raised about mental health patients and even other deadly illnesses like TB and HIV, and whether they are not put at the back foot as resources are being channeled to fight COVID-19. How is the department making sure that while it prioritizes resources for COVID-19, it also doesn't compromise the resources for other health emergencies?
Yeah, I think it's something that we realized after the first lockdown, when we're still, at level 5 and level 4, but it was just for a month. So now we have moved into level 3. So all the preparations are underway in terms of all our programs and projects that are relating to actually to those. But what we have done with the actually COVID also is that we also went to screen and test all our mental health care users in our facilities to make sure that they are not also affected actually by the the virus. But it was also just to make sure that the upkeep and the caring of them actually does continue.
We've seen some disturbing trends, MEC, of stigma in many communities against those affected by COVID-19, which has raised the need for education and awareness around this virus. What are you doing about that?
It is a project, a program, and it's not only in communities, the issue of the stigma. It also happens in the workplace, in the workplaces, and also in our health facilities. But it's just an issue to continue to raise awareness, to spread the knowledge and factual knowledge for that matter, to make sure that people understand that whilst the virus is deadly, it is something that can be preventable, and it's something that can be avoided, and it's something that when you get it, you can be able to recover from it.
Let's talk medical litigation now, MEC. You anticipate that medical litigation would cost the province about 19.8 billion rand this year. That's nearly a third of your 56 billion rand budget. That's a lot of money. My understanding is last year you spent 22 billion rand in lawsuits. These figures probably speak to the staggering levels of negligence in the sector.
Yeah, I just want to put that into context because that figure is a liability bill that has actually spent over 12 years. It's not money that we are spending in 1 year. So it's what we are actually owing. But what we have done is that we have entered into a process of auditing, all the cases that are there. Some of them have remained actually stayed. Some have not been tried. and some actually are duplicates. So the work that has been done in that regard in reducing the actual liability cost, the liability bill, is also just doing exactly that work, doing a proper due diligence on the cases that have been put up or the notices that have been put up. So it's not money that would be spent or a liability for a particular year. It is spent over 12 years, and it's something that we're working on to try and reduce it. The current cases that we are dealing with, we've actually offered and opened up a big aspect of mediation, which as in actual fact has reduced the cost in a big way in terms of what we spend on litigation. But annually, it is something that is around 500 million that we spend on litigation.
All right. Thank you so much for speaking to us about that budget, Dr. Bandile Masuku, the MEC of Health here in Gauteng. All right.